come in. Hello.
Hi.
How are you doing?
Good, thank you.
Good. Well, thank you for coming in to see me today.
No
Obviously, it's very important to have an annual physical exam. So, before we get started, nothing to be afraid of. I just need to take some details. Okay. So, to start with, could you just confirm your date of birth for me?
The 7th of the 11th, 1996.
Lovely, okay. And I'm just going to ask you some general questions about your health and your lifestyle. Okay, so do you smoke at all?
No.
Okay. And what about drinking?
Maybe 2-3 units a week.
Okay. Very good for someone your age. Lovely. And are you currently on any medication?
No, just the contraceptive.
Lovely. And how are you getting on with that? Any trouble at all?
No trouble.
Lovely, okay then. Now, what about your general level of fitness? Would you say you're quite a fit person? Do you go to the gym, anything like that?
Yeah, I go to the gym maybe 3 or 4 times a week.
Very good, 3 times a week. And in a general day, when you're not going to the gym, do you get a good level of sort of general activity, at least 30 minutes a day walking about, would you say?
Yeah.
Perfect. You're definitely going in my good books. Okay, lovely. So, do you know anything about this exam that we're going to do today? No. Okay, it's going to be really, really simple. I'm just going to check some different areas just to make sure that I don't get any red flags or signs that anything's going wrong, but you seem like a generally fit and healthy person just from looking at you, so I'm sure it'll be absolutely fine. Okay,
Great.
so do you have any questions at all before we get started?
No.
No? Let's get on with it then, okay? I just have to ask, are you allergic to latex at all?
I'm not, no.
Okay, lovely. I don't find that many people are, but I always have to ask. Okay. Okay, so to start with, I'm just going to do some general observations that might seem a little bit odd, okay? So if you could just turn your head to the side for me. Lovely, and backwards. Okay, just checking for any redness at all. If I can just feel your throat there. That feels absolutely normal. Your glands are fine. Lovely. No signs of swelling at all feels very normal. Would you mind just rolling your sleeve up for me, just a tiny bit as well? Lovely. Just checking the skin looks normal. Always like to check the hands as well. They all look lovely. Okay, so what I'm going to do is I'm actually going to take your blood pressure. Okay. Have you ever had your blood pressure taken before?
Yes.
You have. Okay, you know what to expect then. Okay, you could just roll your sleeve up for me again. That would be perfect. Okay, so I'm just going to take it now. Just okay. Lovely, that seems normal. Okay. Okay, so now I'm just going to have a little look in your mouth, if you don't mind, okay? Just going to check for any signs of redness at all. Before I do so, have you had a sore throat or anything like that recently?
A little one, yeah.
A little one. Have you taken any medication for that?
Just paracetamol.
Okay, lovely. Let's just have a little look then, just nice and wide for me. Perfect. Yeah, it looks a little bit red, but nothing to worry about too much. Okay, so while I've got the torch, I'm actually going to check your eyes as well. Okay, do you wear glasses at all?
I do, yes.
Okay, is that just for reading or computer work?
Driving.
Driving. Okay, would you rather put these on for this exam? I'm going to do a Schnellen chart next where you read all the digits. Would you like to put those on for that?
No, okay.
Okay, lovely. Let's just have a little look at the pupils then. Okay, that's it. Just focus on a fixed point. Perfect. Pupils are reacting normally, can't see any sign of redness in the eyes or any abnormalities. Perfect, nice and simple. So you may have seen one of these at your optician's. Okay, so this is what's known as a Schnellen chart. You may have seen one of these before. So what I would like you to do is, I'm actually going to stand back there a little bit. I just want you to read, starting from the top, please. If you just like to cover one eye first, lovely, and just start at the top for me.
E,
Yeah.
F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, D, E, C, L, E, F, O, D, F, C, T.
Can we get any of that line? You're doing very, very well.
R, D, F, L, T, C, E, O.
Yeah.
F, E, Z, O, L, F, C, R, T, F.
Come on, the last one.
Z.
Yeah, perfect. Well, you know what? I was going to check the other eye, but seeing as you got it perfectly, I think there's no need for that. Okay, so well done. Let's pop that down. Okay, so now we're just going to do a little follow my finger test. Have you ever done one of those before? You have? Okay, so I just want you to focus on this and just perfect. Lovely, so now I just want you to look at my nose, okay, and I'm just going to do this. Lovely. Perfect. Can tell you've done this before. Okay. Lovely. Sorry, no, this could be a bit intense. But lovely. Good. Just a few more. Perfect. Good. Just a couple more. Lovely. And just a couple more. We'll just finish off with a nice easy one. Perfect. Okay, so now I'm going to do the exact same thing really, but with the light we used earlier. So just simply follow the light. Good. Just a couple more seconds. Lovely. Okay, I'm just going to make a couple of notes. Can I ask how long you've been wearing your glasses for?
About 6 months.
Okay. Do you wear contacts at all at any time?
No.
Okay. Do you get any headaches or dizziness when you wear the glasses?
No, but I do get headaches sometimes when I don't wear them.
Okay, that's fine. Was that the reason when you went to have an eye test? Because you're getting headaches? Okay. So do you find the glasses help with headaches when you're actually wearing them?
Yeah.
Yeah, perfect. Now, another thing I'm going to check is your sense of smell, okay? As we get older, our sense of smell can change, so it can be a sign of something else going on. Have you noticed any changes in your sense of smell at all? No, I'm just going to double check, okay? So, I've got a couple of essential oils here for you. All I'm going to do is just place it under your nose. If you could just identify them for me, that would be great. Perfect. Let's do one more. You are whizzing through this. Okay.
Peppermint.
Perfect. So I'm just going to check your heart rate now. Okay, so I'm just going to pop this in. Okay. Right. Okay, that all seems normal, perfect. I'm also just going to have a little listen to your breathing a little bit more, okay? So I'm going to listen to your chest first and I'm going to ask you to turn around. Okay, so just breathe as you would. Okay, lovely, turn back around. Well, I think you are in lovely good health. So now we're just going to do a very simple hearing test. So I'm going to get you to close your eyes and I'm going to do this sound. Okay, so that's what it would sound like. I just want you to tell me whether it's left or right. Okay, happy to start?
Yep.
Perfect.
Left. Left.
Perfect.
Right. Left. Left. Straight ahead.
Very good, testing you there.
Right. Left. Right.
Okay, I'll just do a couple more.
Left. Top.
Perfect.
Straight ahead. Behind.
Well done. Okay, and you can open your eyes. Perfect. So what I'm going to do now is I'm actually going to stand at a little bit of a distance and I'm going to whisper a word. Just want you to repeat it back to me, okay? If you could close your eyes just so you can't lip read. Okay, so I'll go right back here. Watermelons.
Watermelons.
Camera.
Camera.
Television.
Television.
Kettle.
Kettle.
Microphone.
Microphone.
Curtains.
Curtains.
Good, just a few more. Table.
Table.
Chest of drawers.
Chest of drawers.
Wardrobe.
Wardrobe.
Lighting.
Lighting.
Mirror.
Mirror.
Good, you're doing really well. Just a couple more. Telephone.
Telephone.
Hotel.
Hotel.
Cleaning.
Cleaning. suitcase.
Fabulous. I'm going to open your eyes again now. Let me just make a few notes. Okay, so you've done really, really well so far. Okay, so now I just want to ask you a few more questions. Have you been unwell this year? Anything like cold or flu? You have. When was that?
About 3 or 4 weeks ago.
Okay. And did you have antibiotics for that?
Yes.
You did. Okay. Obviously that cleared it up. Lovely. Did you finish the whole course of the antibiotics?
No.
Okay. So it's always worth finishing the whole course even if you start to feel better. So that's just worth bearing in mind for next time. Have you had a flu jab this year?
I haven't.
You haven't? Okay. Do you normally have one?
Yes.
You do. Are you planning to book in to get one?
If I could, yeah.
Yeah, fantastic. We can do that for you. You can actually head out to reception after this and book that in. It's always recommended. Okay. Do you have any other ailments that have been bothering you at all?
No.
No? Okay. Have you been suffering from any mental health issues, anything like depression or anxiety, stress, anything like that?
Stress.
Stress, okay. And how do you normally manage your stress?
Usually I watch ASMR videos.
Fantastic. I've heard of those. They're very relaxing. Well done. Also things like getting fresh air, getting out into the light can be really, really good for stress, so that's worth keeping in mind. But you do a good amount of exercise, so that's always good for mental health, so that's really good. Have you ever taken anything tablet-wise for stress? No. Okay. Obviously, if it gets to a point where the stress is overwhelming, you can of course come to see us and we can try and deal with that. Okay. Make a couple more notes. So you said dizziness, you're not getting any dizziness at the moment, so your glasses prescription is still fine, I imagine. Fantastic, so I don't need to refer you to the eye unit, so that's great. So obviously you've had the annual checkup. No, you don't have anything like asthma, do you? No, okay. Perfect, so let's just go through some things, okay? Just to make sure I've got everything down. Oh, of course, diet-wise, are you eating fairly healthily? Yeah. You are? Fantastic. Are we getting those 5 fruit and vegetables a day, do you think? Brilliant. I wish more people were like you. Okay, perfect. So the tests were all fine, okay, all really normal, no signs of concern at all, okay. Do you have any questions at all about the exam? No? Fantastic, okay. I don't need to refer you to your eye unit because you're absolutely fine. I am going to put a flag on our system so that you book yourself in for that flu jab, okay. Are you going away on holiday at all? No, okay, so you don't need to worry about any vaccinations, anything like that. Fantastic. So, patient is getting a good amount of exercise. Diet is healthy. All tests were passed, so your hearing was fine, your olfactory nerve, your sense of smell was absolutely fine. Again, some slight redness in the throat, so you can get some pastils to soothe that. I would always say go for sugar-free ones because sugar can actually aggravate the throat, so that's really worth looking into if you wanted to soothe that. If not, things like paracetamol are great. Just make sure you're not taking more than 4 to 6 really within a 24-hour period, but that's absolutely fine. Okay then, I think that's everything. Okay, so thank you for coming to see me, and should you need anything else, you can always pop back. Okay, so on your way and have a lovely day.
Thank you.
Okay. Right, just note that down. My next patient is coming in. Okay, just soon about just clear